Things took a turn for the worse, didn't they, in last night's Coronation Street, when Ken Barlow suffered a heart attack. Poor Ken. Nothing better happened to Ken, and they'll have to deal with me. Dr Hilary joins me now. Apparently now, we're told, we're not sure if this is totally accurate, but he's going to have a stent fixed.
Yes.
That's quite a common thing, isn't it, with somebody that's got a heart condition?
Absolutely. So when someone's had a heart attack, there is a blockage in the coronary artery, the artery that supplies oxygen to the heart muscle.
Right.
So that blockage needs to be dealt with. So when someone's had a heart attack, they call 999, they go into hospital, they probably go straight to a cardiac catheterization unit, and using either an incision in the groin or the arm, a catheter is fed into that coronary artery.
OK.
And a balloon is inflated where the blockage is.
Wow.
And that dilates the artery that's been narrowed or blocked and allows blood to flow through again.
Gosh,
now, the
amazing.
stent
Yes.
is a wire mesh.
Oh, is that
which
what it is? Right.
is pushed open by the expanding balloon and is left in place, holding the walls of the artery open when the balloon is deflated and removed. So that's stenting.
Right.
And it's a really good operation. It's done, usually takes between 30 minutes and 2 hours. The sooner it's done after the heart attack, the better, because it preserves the life of the heart muscle.
Sure.
And most people can, be discharged within either the same day if it's angina, or within a few days if it's a heart attack, and go on to have cardiac rehabilitation and lead pretty normal life.
Yeah, you just have to be a little bit more
But it's a
careful.
great storyline, Lorraine, because
Well, it's got people talking about it.
170,000 people will die of a heart attack every year in the UK. 40,000 of them are under the age of 75, so that's one person dying every 3 minutes.
Jeez.
So alerting people as to the signs and symptoms of a heart attack or angina is really important.
So if it starts with chest pains, I mean, I know there's a big difference between a heart attack and some people who've got, like, for example, chronic indigestion sometimes think they're having a heart attack. If you start getting anxious, you think you are. So what should you be looking out for and be worried about?
So a heart attack will give you a crushing, intense pain in the chest, like someone sitting on your chest, a tightness or a crushing pain.
Right.
It's going to be there permanently. Medication isn't going to relieve it. It can pass to the arm or to the jaw or through to the back, sometimes into the abdomen as well, so the pain isn't necessarily all in your chest.
Right.
You're likely to be quite breathless, you're likely to be sweaty, feel a bit sick, you have this feeling of impending doom. And it's an emergency that needs to be treated straight away. If it's angina, that means there's a partial blockage or narrowing of the artery, and you're feeling pain because the heart muscle, just like a leg muscle that's going into cramp, the heart muscle is going into cramp and you're getting pain.
Right.
So that's a temporary pain. It's usually relieved by your medication. If you're already on that, you might feel shortness of breath, and it's typically brought about by stress or exertion.
Oh, I see. What about the thing they used to say that you get a pain down your arm? Does that happen sometimes as well?
The pain can radiate down your left arm, usually, but sometimes in both arms, sometimes your jaw, sometimes your back. So these are sort of classic symptoms of a heart attack or angina. And anyone who's worried about it should obviously, if they think they've had a heart attack, 999 into hospital straight away. Angina is probably diagnosed by your doctor based on a history of what's going on.
But you sort of know your body and you know when this is actually serious and we do have to phone 999 and we do need to get into hospital really quickly. Because it's amazing now what surgeons can do and how you can be saved. You know, people that we were losing. Are now,
absolutely.
But you can't leave it too late.
And it's a pretty safe operation, stenting. It's very effective. If a stent isn't appropriate, people can still have a coronary bypass. If there's multiple blockages, you can actually bypass those multiple blockages using a blood vessel from somewhere else. And that's like literally grafting it on and bypassing the blockages.
Sure.
So there's also clot-busting drugs, which we still sometimes use if people can't get to a stenting unit early enough. So there's lots we can do.
No, there is. And what about sort of preventing this in the first place? And can heart conditions be something that maybe you live with, but obviously lifestyle has got to affect it in some way?
There's 4.5 million people living with heart disease or circulatory disease in the UK right now, so of course you can live with it. But we know what the risk factors are. So being overweight, having a poor diet with lots of fatty food, processed food, fried food, that sort of thing. Smoking is a major cause. Lack of exercise, high blood pressure, type 2 diabetes. These are all risk factors. And, of course, increasing age. You know, we're more likely to develop hardening of the arteries as the years go by. But there's so much we can do. We can not smoke. We can eat a healthy diet. We can exercise regularly, keep our blood pressure under control, avoid stress. We can all lead healthier lives. And actually, the figures are coming down slightly. So we are doing better than we did.
Oh, that's good. So the message is getting across.
Slowly, yeah.
And also things like, you know, I was talking about it today, but obviously we were doing that off the back of Corrie doing the whole thing with Ken Barlow. And that's where, actually, I know soaps are for entertainment, but they can really help as well.
No, they really do. I mean, we've covered storylines covered in soaps over the years, and they're very good, whether it's HIV or alcoholism or, you know, depression, you know, all sorts of things. And people identify with these characters and they say, right, you know, that sounds like me, I'm going to go and get something done about it. So all credit to the scriptwriters for doing a great job.
And Ken is going in for surgery, and it better be effective.
It better be.
Or else.
I mean, what would Corrie be without him?
It's not even worth thinking about.
Looking for more health and wellness content? Well, there's plenty more really useful information right here on our channel. How about you check out this one?